You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Dr. Kelly McCann. She's working in cutting-edge medicine and functional medicine, integrative and environmental medicine instead of just normal allopathic. She works on complex chronic conditions like mast cell activation syndrome, mold toxicity, and persistent infections. So we're going to talk about some of the big bad conditions that she helps treat in her unique way. So welcome.
Thank you so much for having me, Richard.
If you would, tell me a bit about your background. I've noticed that people that usually work in certain conditions, unfortunately, a lot of times they've had problems with those conditions themselves. I don't know if that's your case, but what's your background?
Actually, that's not why I got into it in the first place. I was always interested in holistic medicine. In fact, I wanted to go to acupuncture school when I was considering medical school, and my parents really wanted me to go to medical school. And so I made a deal with myself that if I didn't get into medical school, I would go to acupuncture school. And gosh darn it, I got into 4 medical schools. And so my fate was sealed. But
you didn't throw the fight, didn't you? You didn't throw the fight, I guess.
No, I figured there was a plan. So I went to Tulane University and got a master's in public health and tropical medicine along with my medical degree. Went on and did a residency training in internal medicine and pediatrics, which was a 4-year, very intense residency program. And
did you do it here or overseas?
Oh, no, I did it here. I was in Phoenix. Yes, I was in Phoenix, Arizona at Banner Samaritan. And we also...
That's not tropical, that desert.
No, that's not tropical.
Maybe Louisiana might be tropical or Houston. I don't know.
Yes, it definitely is. Definitely kind of a third world country down there. I love New Orleans. It is a beautiful, amazing place, and there's nothing like it in the United States. But I spent 3 months in Ghana, West Africa, as part of my MPH during medical school, which was fascinating.
Yeah, what kind of conditions did you see and treat there?
We saw lots of real parasites, not these supposed parasites that people are treating on TikTok these days. There was a parasite called schistosomiasis, which infects the bladder and causes blood in the urine and bladder cancer and all sorts of kidney issues as well. We actually spent a week at a leprosy colony, which was fascinating. Leprosy is actually related to tuberculosis, and it's much less contagious than tuberculosis. You really have to live in close proximity to somebody who has leprosy, and it's very, very slow growing. So I learned all about leprosy.
What is leprosy? Like, where does it come from?
It's a bacteria. So it's a bacteria like tuberculosis is a bacteria, and it is pretty unique in the way that it operates. There's a real dynamic between the organism and the body, and it doesn't really like the body temperature so much. It's a little too hot for it, and so it tends to impact the extremities more so than the central core of the body. And so it's on people's noses and ears and fingers and toes, and it does a number of things. It destroys the nerves, and so people don't have sensation. And it also causes a degradation of the tissues, and so that they can, basically get parts that kind of fall. They're not falling off because of the infection per se, but they don't sense when they're doing damage. So that's oftentimes why they'll damage certain body parts. And the way that it manifests, it can be a loss of sensation without much deformity, or depending upon the immune response, they can have these huge lipomatous lesions. And these are kind of the pictures that we see in movies and TV where they have these gigantic growths all over their faces, and they look very disfigured and misshapen. And that is because of how their immune system is responding to the bacteria.
Right. Okay. Are there any, or just, a couple more questions about leprosy.
Sure.
Can it be cured or treated, or what do you do for it?
Yes, it can be treated by typically long-term antibiotics. Just like when somebody gets tuberculosis, oftentimes they're on multiple drug regimens, 3-4 medications for months and months and months on end. And depending upon how far progressed people are in terms of the infection and the damage that's already done to the tissues, they can stop the further progression, but they don't always recover their sensations, or if something's happened to lose a finger or parts of the organ, like they get a saddle nose where some of the connective tissue has been lost in the nose. Yeah, so my joke was I learned how to spot leprosy from across the room by certain characteristics. Yeah,
Here.
it's a fascinating disease. And I think the thing that translates into our more modern society is that there's an interplay between all organisms and our immune systems. And this comes into play when we're talking about Lyme disease and all these other chronic infections that we can dive into if you want.
Okay, let's talk about Lyme. I guess that comes from deer ticks, supposedly.
Yeah, so I think there's a number of misconceptions that Lyme is one thing. So Lyme is technically a single organism called Borrelia burgdorferi, and it was identified in 1981 by Willy Burgdorferi, and so that's why it's called that. However, there are multiple species of Borrelia, and these Borrelia act very similarly. They look very similar. There's some genetic differences, of course, which make them as different species. But for all intents and purposes, they produce the symptoms that we call Lyme disease. And so people can have multiple different bacteria that are causing what we're, kind of generically calling Lyme disease. And that brings up a whole host of issues when we're talking about diagnoses and even potentially treatment, because there's a misunderstanding that Lyme is this one thing when it isn't. And on top of that, oftentimes the ticks that can be infected with Lyme that transmit the infection when they bite the human through the saliva, these ticks are also multiply infected by other organisms that include different bacteria, viruses, and parasites.
Do the tick, I'm sure they have their own microbiome, and then the multiple infections probably they change the Lyme.
Yes.
The Burgdorferi, I don't know, or really, what's the genus name again?
Borrelia.
Borrelia. Yeah, I'm sure they change it, radically in person to person.
Well, and that's the interesting kind of segue from talking about, leprosy, which is basically extinct in most of the world, to Lyme disease, is that it's really about the interplay between the bacteria and the host, the person who has the disease, because depending upon the robustness of somebody's immune system and where their genetic weaknesses might be, their predispositions, that will in part determine what their presentation is, because very few people have the same exact presentation when they have Lyme disease.
What are some examples? Are they exhausted? Are they foggy-headed? What happens?
Yeah, so many. It's a long laundry list, right, of potential symptoms. So oftentimes people will complain of fatigue and brain fog and just muscle weakness and exhaustion. They tend to have more kind of migrating symptoms. So it might be migrating joint pain, moving from one joint to another joint to another joint, migrating nerve pain where the soles of the feet hurt, and then the hands hurt, and then they've got, burning pain in their backs, and then migrating muscle pain. So those are some of the big primary symptoms, but people can also get migraine headaches. They can develop gastrointestinal issues. They can develop a cystitis, interstitial cystitis, and genitourinary symptoms, all neurological symptoms. Actually, we see a lot of neurological and psychiatric symptoms, particularly in children, where they might get significant depression, anxiety, mood disorders, ADHD, autism, bipolar disorder, and they may not have a lot of these other physical symptoms. And so, these children can end up in psychiatrist's office, and really the problem is not in the brain. It's in the brain inflammation, and it's being driven by these underlying infections.
So what's I don't know, from a functional perspective, that if someone has Lyme disease, you're not just going to throw medications at them. You got to look at their biomarkers and try to make sure that, they're in good shape health-wise, their diet's right on, all those things. Or what else is there to, evaluating the person from a functional perspective?
Sure. Everything is important, right? So if we're talking about the terrain, if we're talking about the health of the host and really wanting to boost up the function of their immune system. So the goal is not necessarily to eradicate the bugs, right? We have to oftentimes live with these things. We live with our microbiome. We live with all the bacteria on our skin, the yeast on our skin. And what we want to do is be able to, in many ways, cohabitate with these organisms such that our immune systems can keep them at bay and keep them in check. When symptoms arise, it's because our immune systems have been suppressed and then the organisms just flourish. And so there's a dovetail effect that happens when we're not eating well, not taking care of ourselves, not sleeping enough, or when we get hit with other things that can suppress the immune system, chronic stress, toxic relationships, traumatic events, other inflammatory conditions, like say somebody has Lyme disease and they don't even know it and they're doing okay, and then they get COVID and they never recover. And, they get diagnosed with long haul COVID and they think that COVID is the problem, but in actuality, they were set up because they had a chronic infection, bacterial infection underneath it that their immune systems were managing, but now they can't. And the immune system is just, caught on fire. And so a lot of these patients, this is what's going on.
Yeah, so what do people that come to you expect, things to take months because they have to get their own physicality in shape first to be able to battle the infection or to make it go away? Or what are the hallmarks of your approach? What do you tell people?
So when people come in, sadly, oftentimes they have seen a dozen, 2 dozen, 3 dozen other practitioners. They're still not well. Nobody's figured it out because there are oftentimes multiple pieces of the puzzle. We love this idea in medicine of Occam's razor, that there's one unifying diagnosis that's going to wrap all of these symptoms up in a bow. And, all we have to do is find that one thing and everything will be fine. Sadly, that's just not how it works. It's much more complicated than that. So when people come in, what I want to know are what are the symptoms? And then based on the symptoms, my history, experience, the patient's intuition, my intuition, we're using those tools to go after and identify what are the root causes of dysfunction. And of course, I want them to feel symptomatically better. So we start applying some things that I know that would help. Like oftentimes if somebody has an autoimmune condition, for example, we got to clean up the diet. No more gluten, no more dairy, no more sugar. And that will get us hopefully a certain percentage better. If people have mast cell activation, they're already inflamed. I can't do anything about the infections until I calm down those mast cells. So I'm really...
What is a mast cell? What does that mean?
Yeah, sorry. A mast cell is part of our immune system. It is born in the bone marrow. So it's related to our red blood cells and our white blood cells. It moves to the areas of interface between ourselves and the outside world because its job is to be a guard. It is the sentinel. It is the keeper of the gate and the one who will sound the alarm if it perceives a threat, a danger, a foreign invader. And so when it perceives a threat, it sounds the alarm. The alarm is the release of chemical messengers we call mediators, cytokines, chemokines, enzymes that will then send a message to the rest of the immune system. Hey guys, we have a problem here. You got to come over here and help me deal with the problem. And what that does is it mobilizes the rest of the immune system, the white blood cells, the monocytes to come and deal with that threat, which then leads to other things. But the idea is that a mast cell is something that we all have, and that's its job. What happens in some people when their bodies feel constantly under threat, as in they have a chronic infection, they're living in a moldy house, they're chronically exposed to different kinds of environmental chemicals, the mast cells can get turned on. They become hypervigilant and they lose the power of discernment, and they can't say that's a bad guy, that's a good guy. And they start just sounding the alarm to everything. So people develop sensitivities to the foods they eat, different scents and smells, and sometimes even pressure. I've had patients who can't drink regular water out of the tap. They have to have a specific kind of water. They can only eat 5 foods. Out of all the foods on the planet, they can only eat 5 foods, and sometimes they have to be specific brands of those 5 foods or organic versions of those foods because their mast cells and their immune system is so on fire.
So they're just, I guess, hyper-reactive to all kinds of stimuli. So you need to calm down the mast cells first by not provoking you with gluten and sugar and all kinds of stuff.
Sure, correct. Yeah, so...
How long does it take until what will you notice when you're getting a calming down of those kinds of cells?
So typically, a lot of the inflammatory, allergic kinds of symptoms get better. And we use a variety of different tools like certain medications, lots of different supplements, different kinds of nervous system work, vagus nerve exercises, things like that help calm down that hypersensitivity, that hyper response. And then what people will see is that they're better able to tolerate things. They can add a few more foods. They can hang out in places that previously triggered them before. They don't feel afraid all the time. So they start to slowly see improvements in all of their symptoms.
Okay, and then what? What is it? Usually 4 weeks, 6 weeks, and then you're able to treat differently, or what happens next?
Good questions. It really depends on the person, and it depends on how sensitive they are. For many people who are chronically ill, conventional medicine fails them horribly. They have symptoms in almost every symptom. So they go to the cardiologist for their palpitations or their dizziness. They go to the urologist for their bladder infections. They go to the gastroenterologist because they can't really digest their food. They go to the endocrinologist because their hormones are out of whack, or the rheumatologist because they have an autoimmune condition. And none of these specialists, unless they are trained in functional integrative medicine, are looking at the whole person. They're just looking at their one little area of expertise. And that means that they miss the big picture and the patients actually don't get better. So oftentimes what happens is they try to find somebody to help them, not understanding or recognizing that they need a different kind of paradigm to help them. And so it takes them time. And hopefully they listen to podcasts like this and they hear some hope and some ideas of ways to think about things differently. And then they can start to find practitioners who can really help them. So it totally depends on where they are in their process, what we would do next.
Okay. So have you been able to resolve Lyme in people? Or what kind of, at the end of the whole experience, what have you been able to do that other people can't do?
So the end of the whole experience is that their lives are actually better than before they got sick. And, a lot of people have this idea that they just want their lives back, right? Just want to be who I was before I got sick. And what I've come to realize is that we get sick because we're on a journey of internal exploration and spiritual growth and development. And I know it sounds a little bit crazy to talk about that way, but that's really been my experience, because the way that I think about it is symptoms are the messages from the body to the being, the person, that they are not living their lives for their purpose on the planet. I believe that we're all here for a purpose. We're all unique. We all have our own individual destinies. And when we do not listen to our intuition, when we discount ourselves, when we live in fear of being who we really are, our body gives us feedback. And that feedback are these symptoms. So when we work together to resolve the symptoms, we're actually also working to resolve the misunderstandings, the misbeliefs about who they are on the planet. And as a result, when we're done, it's not about symptoms. It's about living a life of joy, purpose, and meaning, and self-love.
Well, how are they supposed to do that if they're not feeling good every day and they're just a mess? Busy with.
Well, that's a very good point. And we don't really start there, right? So, if things feel terrible all the time, you can't force your will to get you where you think you want to be. So it's a process. And we start with calming down the symptoms, giving the person more tools, helping them understand their nervous systems, helping them understand their immune systems, feeding them healthy food, educating them so that they can feed themselves healthy food, making healthy choices for themselves, and then really identifying the things in their lives that aren't working for them. If you're living in a moldy house, really hard to get better. If you have a chronic infection, we deal with the symptoms, we deal with the infection, and support the immune system, and build in thought patterns and shifting ideas about the person so that we're building more resilience.
Okay, very good. Where are you able to help people? Can you do telemedicine, or is it just local to a particular area?
So as a medical doctor, I can only practice in the states where I'm currently licensed, but I'm licensed in 12 states in the country. So I do ask that patients come to California for their initial appointment to see me or my other practitioners in our clinic, the Spring Center in Southern California and Costa Mesa, California. And then after that, we can do telehealth. I do ask that people come annually to be seen in person. I have patients all over the country, New York, Florida, Texas, Arizona, Colorado, Illinois, and, they appreciate the fact that, one, that they can come to California because it's always awesome to come to California, and two, that they can get the care that they need, even if they don't live nearby.
Well, you're a real slouch. Only 12 states. That's a lot. That's amazing.
Yeah, thank you.
Yeah, quick question about that. How much effort did that take to do? That seems to be like years of effort to do that.
Well, once you have a medical degree and then I've finished my residency, then you have to get a license to practice, but it's just another application process. It's not like I have to take another test for each state. And I worked in a lot of different states. So when I was in Arizona in my residency, I got an Arizona license, and then I moved to Oregon. And because I was nearby in Washington, I got Washington. And then I moved to California. And what happened during COVID was that all the telehealth state laws opened up so that patients could be seen from anywhere in the country. So I had patients coming in from all over the country to see me. Well, coming in. They weren't actually coming in person. We were doing telehealth with everyone. And then at the end of COVID, all the state boards decided that they wanted to get their piece of the pie, and they didn't want practitioners to be practicing in their states without a license. So many of the states clamped down on licensure and made things very strict again. And so I had all these patients that I felt responsible to, and I wanted to continue to help them on their journeys. And so I went through and I applied for a whole bunch of other licenses so I could continue to care for those patients.
You think that would be a cool credential if, I don't know if anyone's done this, but what if you get licensed in all 50 states? You think that would do anything for you except be like a really interesting talking point?
It would also be very expensive.
It might be cool though. Then you could say that you're the only functional medicine doctor, maybe the only doctor at all to license in all states.
I think there are some clinics where they have a number of different practitioners, and in total they cover all 50 states. I think for one single doctor in a private practice, it's not financially sustainable or feasible. But I think my number is pretty good for now.
Yeah, no, I think it's really cool. That's great.
Thank you.
Well, very good. There you go. Thank you so much for coming on the podcast. And it's nice that you have this approach. I mean, it's necessary for the complex diseases that you're talking about. Otherwise, I guess that's why you're the 20th person that a lot of these people visit, because and I can help otherwise.
Exactly. And, although I'm doing mostly complex chronic illness, all of these things apply to other people, right? Because we're all exposed to environmental chemicals. Many people have chronic infections and they don't know about it. There's plenty of people who have poor diets, and surprisingly, a lot of people exposed to mold who have no idea. And all of these things get into our bodies and affect us. Our bodies are like a sink, and some people's bodies are really great at detox and really great at eliminating these chemicals and these threats. And they have high levels of resilience and a strong immune system. And they have big sinks, right? Big drains. That's the analogy. But many people have kind of shallow sinks and narrow drains, and they can't tolerate all of these different exposures. And so if people just have an autoimmune condition, irritable bowel syndrome, fibromyalgia, Hashimoto's, hypothyroidism, low testosterone, if they're having a really hard time with menopause, if they have PCOS or endometriosis or many of these common conditions, they also have these issues. They just might not be as far along and as sick as some of the people who end up on my doorstep. So everyone can benefit from a deeper perspective of functional medicine. It's not just for the super sick. It will help anyone who's interested in really getting at the root cause of their health issues to flourish.
I just wanted to wrap up and say thank you so much for what you do in general, and then for what for coming on the podcast and explaining all this.
You're welcome. My pleasure.
Just to reiterate, how can people reach you? Because you probably don't have nearly enough clients. What's a good website for them to go to?
Sure. So the website is thespringcenter.com. That's THESPRING center.com, spelled the American way. And you can also go to my personal website, Dr. Kelly McCann. That's Dr. Kelly McCann. 2 L's, 2 C's, 2 N's.com, and learn more about me, read blogs, and watch webinars. And if becoming a patient is of interest, you want to go to thespringcenter.com.
Very good. Well, Dr. Kelly, thanks so much for coming.
Thank you, Richard. Have a wonderful day. Thanks, everyone.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.